our next speaker today is Dr. Sai Praveen Haranath, Medical Director at Apollo Hospitals. Uh, Technology is playing an increasing role in several patient care workflows in a hospital setting. And Dr. Sai Praveen Haranath will kind of educate us on how deep tech and IT are being used today in various patient care flows, as well as what the future offers, right, in terms of deep tech advances in improving both care delivery as well as outcomes. So over to you, Dr. Sai.
Hi, good afternoon. This is Sai Haranath. I am actually overseas in Lisbon at the International Hospital Federation World Congress. So I'm using the local Wi-Fi, so it's possible my audio is spotty. I would turn the camera, but then the light's too bright. You'll be looking at a replica of the San Francisco Bridge, which Lisbon has. But at the same time, I thought I'll share some of the information that I've been learning as well as using during my journey in terms of using technology and health. Uh, and anytime you're not able to hear me, just let me know. I will try to kind of slow down. So in terms of deep tech and the future of healthcare, I think the key elements are that we really need to look at the human element as the number one piece, especially in healthcare. And if you look at excellence, expertise, as well as empathy, these are the three value systems by which we at Apollo Hospitals actually do anything both patient-focused as well as processes as well as remote care. The main learning that I have had, which I could share with you, is that unless you have a partnership between the technology provider as well as the actual clinical provider and the patient, it's unlikely that you will have lasting or sustainable success. And there are plenty of startups, plenty of ideas which have, despite good funding, despite great brains being together, were not able to kind of go to the next step, mainly because the process was not followed where there was a collaboration and a collaborative discussion on how we can take this forward. So deep tech, while it is transformative, disruptive, and also invisible sometimes, it is important that we need to look at the end user, which is the patient and the provider. So if you look at the reality of healthcare, now this little creature out there has killing 800,000 people a year. We have not conquered the mosquito. Despite our advances in traveling to Mars, retaining and getting samples from asteroids, we have not been able to conquer these human problems. And I think it is not a question of the technology not being available. It is probably related to the processes not existing to deploy this at scale. Now, the issue that I think which is important for us to realize is that unless we get deep tech from the lab to the bedside, from the bench to the bedside, and the bedside beyond a hospital into the homes, as well as anywhere a patient is, we have not really achieved success. And I think we need to now work on consolidating using the advances in technology to figure out a way to get the existing models to everybody. And what will then happen is that we will learn how to do these things more efficiently and decrease the cost of care. And once we decrease the cost of care, those savings will move to other areas. Uh, Looks like the slides are on auto move, but in this slide, I've also put in a few other concepts which I think are somewhat transformative, which are not yet in the mainstream. There are pilot projects, there are proof of concepts, etc. At Apollo Hospitals, we use a lot of these subheadings there, but I don't think it's available at scale, and that is something we should look for in the future of healthcare. Now, I read recently about a device that is being developed at the University of Washington, which actually powers itself using ambient radio waves. And that I thought is a very sustainable as well as a unique concept where you can actually do things where you don't need batteries. And in healthcare, there are plenty of things which don't need a lot of power, but they need to be everywhere. And it's possible that we may be able to use things of this sort to power structures which are in the healthcare industry. We all know that there are wearables. I mean, I have a wearable on my wrist, which is on my watch, which is measuring my heart rate variability, looking at my temperature and pulse oximetry if I need to. The same devices are being used in a medical setting. In our hospital, we now have deployed this in about 1,000 beds, or 1,200 actually, and increasing it rapidly. In the last 6 months, we've watched about 25,000 patients, which is about 75,000 patient days. We've been able to decrease the number of emergencies, decrease the number of code blues, as they call it, increase the access to rapid response. We've also been able to increase the access to nurses having more time because the vital signs are automatically charted. Biomarkers are something that we should look at for the future, and these include easily available continuous glucose monitoring devices using commercial ones, what Abbott makes, Ultrahuman makes, so which are actually things you can actually measure the glucose continuously and might even be useful, I think, in a healthcare setting where you decrease the work of actually checking the sugar. Likewise, there are multiple other companies making devices which can measure other products which are important in the human system. Interesting idea is breath analytics. It has gone up and down in the few years, but people are talking now about using newer ways of measuring microscopic nanomolar amounts of chemicals in the breath to understand what is happening to a patient. And the last thing I just want to touch base is in terms of invisibles. Now, the invisibles are technologies which measure vital signs. They look at now what Kanan was mentioning about looking at the face and doing AI. Likewise, you can measure vital signs using just an image or a camera or even radar. And there's LiDAR technology, which is now able to measure respiratory rate, respiratory movement, sleep apnea, heart rates, etc. Now, these are all wonderful technologies, which are many of them are already deployed, but they're not deployed at scale. And the benefit of deploying at scale is that you will be able to leapfrog communities which do not have healthcare right now, which do not have intensive care units. You can very quickly, at a low cost, convert them into a monitored setting using all of these low-cost devices. Now, all of this information then needs to get into an intelligent engine of sorts, which can do the AI in the background, but in addition, also have clinical insights that can be given to the patients as well as the providers, and that this can be done from any kind of a setting. Now, in terms of what we have done, we have been very active in the telemedicine space. The left side is a picture that we had published in a critical care clinic, which is a large journal looking at all kinds of things in critical care. And this issue was on telemedicine. And we were kind of writing about what can we do for critical care. And we showed that in India, we actually have deployed all over India and are doing remote critical care. During COVID, we were extremely active. We have now expanded this to patients who are not in the ICU, what I had mentioned earlier. In terms of what's coming next, I think it's very important. I mean, people perhaps expecting me to talk about the latest high-tech stuff, but I've really realized that the technology is going to change. Moore's law is going to be active. You're going to have very smart people like everybody at Nasscom and the other communities creating things which are miniature, microscopic, nanoscale to solve these problems. You're going to get quantum computing coming into all our systems. You're going to have AI everywhere, if it already isn't, and you're going to have a way to actually measure vital signs along with other kinds of things we don't even know about in a very easy fashion. But ultimately, the human factor is going to play a role. Now, the financial industry is seamless. You can use your ATM card anywhere in the world. Trust is built into that. There is value built into that. We know that there is faith that a logo of a certain company means something. Likewise, in the airline industry, people fly safely. You have the air traffic control of every country, every region, very seamlessly handing off people from one plane to the other in terms of the communication that happens. Now, when we can do this so efficiently on a daily basis with almost zero error rates, why can't we do it for healthcare? And I think over there, the human factor plays a role. I think it's very important that we believe that there is value in what we do. We need to show that the outcomes are good. We need to show that the cost is affordable. Likewise, we need to recognize the barriers and build the bridge and look at what are the risks of even going in the direction that we want to take, especially with deep tech, where the investment might be high initially. Likewise, we need to look at the fact that healthcare is built on trust and faith, and how can we make sure that the reputation of the healthcare provider is kind of sufficient enough to make sure that patients believe in it and providers themselves believe in the quality that's being given. And of course, what are the actual deliverables that are happening? So the last 7-8 minutes, what I've touched on is that technology for deep tech is completely available to deploy. The biggest areas you should look at are measuring vital signs in a non-contact fashion or using tiny, tiny devices which use very little power, are very low cost, and can be deployed at scale. I've also talked about the use of one of the care devices as well as devices which can use artificial intelligence to get insights from both biochemical as well as AI-based visual imaging. The third factor I talked about is the requirement that there is partnership between patients, providers, as well as the ecosystem of inventors. And the last thing I would really say is all of us need to realize that healthcare is a very personal thing, as we saw during COVID, and you need to make sure that the healthcare that you are going to access, which may be your community hospital, it may be a clinic that you go to, that they have the best solutions available so they can save your life when they need to in an emergency. So I'm just going to stop there and really say that I really appreciate Nasscom for giving me this opportunity to have a quick chat with you all about what I believe is the requirement for taking care of patients with deep tech. And I believe this is the future of healthcare. Again, thank you very much.